What I wanted to move on to now is a discussion about the social care provision that the government are saying they're going to address. Boris Johnson apparently is going to sort this all out. One of our panelists who's got to go off pretty soon is Dr. Bob Gill. Are you there, Dr. Bob Gill?
Hi, Crispin. Yes, thank you.
So if you could see from the Observer, it says new social care plan will help just 1/10 of those in need of support. If we look at this story, think tank warns of black hole in NHS funding plan and crisis, which one? Staff are quitting, flu is coming, and the elderly are fearful. That's just a few stories, but there are so many aspects of this that I'd like to talk about the situation now with social care. How do you see where we are? What do we need to improve? What is the situation?
But fundamentally, there's a growing need for social care, particularly the elderly and disabled who live in the community, but there's diminishing resource. So we've had 10 years of austerity. I think social care funding has dropped by 40%. And the staff who are carrying out this important work are on minimum wage or less. Some of them have to pay for their own petrol. The time taken between patients is not paid. So you have a high turnover of a demoralized workforce. There's not enough of them, and they're unable to deliver the quality of care they would like. So good people are broken and leave. The continuity for the patients is not there. And very often, unfortunately, when I do come across a carer, when I go and visit patients at home, they are rushing to get to the next patient. They're unable to even exchange basic human interaction with very needy people who, that might be the only person they see for that day. So the quality of service is very poor, and that's not down to the people who are trying to provide it.
Yeah, and what do you think about the government's way of saying it's going to deal with this situation? Because does it appreciate the gravity of where we are?
Not at all. It doesn't get us back to where we were in 2010. It's a regressive tax. The way they're framing it, they're still looking to grab people's assets. Although they've put a cap on it, that cap applies whether you've got a low value house or a multi-million-pound house. And the middle classes with their accountants can offload their assets before they ever need to use social care. But what we're seeing is not a problem designed to solve the care crisis. We have an initiative which is framed in the insurance industry language. You've got a hypothecated tax. It's linked to national insurance. That connection can be made to private insurance. And an article in the FT was showing that the insurance industry are quite happy with this arrangement. It gives them some certainty to start devising products to flog to people to cover their social care needs in the future. We need to return to public provision. That's key. The money going into the social service provision is going into private vulture capitalist entities that are there designed to maximize profit. And if that means saddling their enterprise with debt and going bankrupt, so be it. That is no way to run a satisfactory, high quality social service.
Now, I'd like to also bring in Ellen Clifford, who's also from DPAC. Ellen, are you there?
Yes.
Thank you for coming on. Now, Dr. Bob Gill was talking about how the government hasn't really addressed the situation here, but one thing that hasn't been spoken about much in the media is that many disabled people, need social care, and it isn't just about older people, is it?
No, this is one of the big issues that disabled people have with the way that the narrative around the social care question's been phrased. And I just saw in the chat that Vicky picked this point up, because actually a third of adult social care users and around a half of the budget is actually spent on disabled people of working age. And disability prevalence among working age population is actually increasing. I mean, that could be down to self-reporting, for example, but certainly people are children who were born disabled do now have better expectations, which is absolutely brilliant. And there are other impairments that are also on the increase. So this is a very important part of the debate that really is deliberately, we would say, missed out. The funding issue is very different depending on whether you have been born disabled, and we know that statistically disabled people are a lot less likely to be in employment, for example. So when we're talking about older people, we're possibly talking about people who were able to work for a living. So the funding question between the two groups can be quite different, and I really look forward to hearing other people talk about that later. But I think that the key thing I want to touch on is that the quality of support that is expected for people of different ages is also very different. So when we're thinking about older people, then perhaps there's a tendency to think, well, they've had a good life, so all we're going to do is it's fine to possibly put someone in a home and just make sure that their basic needs are met. But if we're talking about disabled young people, for example, or disabled people of working age, then actually what we want is to be able to participate in life with the same chances as everyone else. And that's actually a right that is written in Article 19 of the Convention on the Rights of Disabled People. And when we're talking about the kind of support that people need in order to have those same chances, then that's very, very different to just meeting someone's basic needs. Unfortunately, the situation in this country at the moment has become increasingly one when disabled people are not even having their basic needs met. And that's actually happening in people's own homes. So the United Nations Disability Committee actually kind of came up with a term, which I think they were thinking specifically about the UK when they started using, but they've been talking about reinstitutionalization in people's own homes. And that's when you don't have enough support to leave your house, to be able to have basic things like washing or cleaning done every day. And we're increasingly seeing this situation with disabled people trapped in their own homes. I know one young man was told, you have everything within your own four walls, so why do you need to leave? And that was by, a social worker. So funding that level of support is obviously a bigger requirement. It entails also very different kinds of support. It really does need the kind of support that is focused on what we call in the disabled people's movement, we call it independent living. That isn't people doing everything for themselves. What we mean by that is people having the same chances to participate in the community. That needs a very different attitude towards disabled people's rights than we often see, unfortunately, within the health service, because obviously the health service is focused on treating people and getting people better. But for disabled people, the social care we need is focused not on curing us, but on giving us the support we need to have the same chances as everyone else, like I say. So what disabled people really want is a fundamental overhaul of the entire social care system, so that it can be focused much more around what we call the social model of disability, that sees that there's nothing wrong with disabled people. We don't need to be changed or cured necessarily. We do definitely want relief for pain or distress, etc. But we want to be viewed as equal beings, and that's why what we want, this fundamental overhaul to address, that's definitely not on the Tories' agenda.
Well, thank you. I might just go back to Dr. Bob Gill. Do you think it's deliberate that they haven't really spoken much about disability in these proposals?
Yeah, I think it fits into the narrative that they have been concentrating on. There is a perception that these are lives not worth treating as everybody else. So I think they would have a harder time if they brought disabled people into that conversation. So we know that Boris was caught saying, let the bodies pile high. The government have got away with, triggering off a pandemic within the nursing homes of elderly people, and that didn't get the public outcry that it deserves. And perhaps by not mentioning the disabled community, they are avoiding people scratching their heads and asking deeper questions about what's going on.
Right. Well, thank you for coming on, Dr. Bob. And I'm going to move on to Paula Peters, because Paula, you've been highlighting the situation for disabled people for a while, and you've got some campaigning coming up as well. if I could just find, there you are, Paula. Thanks for coming on. What do you think about what Ellen and Dr. Bob Gill have said?
Well, Ellen's my solidarity sister at DPAC, and I totally concur with what she's actually said. And I think we also need to highlight that during the pandemic, the government used the Social Care, the Care Act of 2014 and the easements under that act to give local authorities a way to cut social care during the pandemic when it was needed the most. In my local areas here in Bromley and also Croydon, social care was cut by 20%. So in Croydon, over 7,500 residents who needed social care had their care packages cut, and 2,500 disabled people with very high support needs had their social care cut. And, you know, you were seeing, you know, disabled people, I've had disabled people contact me during the pandemic who had support with being able to eat being cut, so they've lost an awful lot of weight. You're seeing when the Independent Living Fund closed in 2015, you know, disabled people highlighting the dreadful issue of having to wear nappies at night time because there wasn't the care there. And you know, my partner's mum's in sheltered accommodation, and you know, they have a care link system they pay £100 a year for. At the start of the pandemic, there wasn't the staff there. Our neighbour had a fall, and I had to go and pick her up because there wasn't the support there at all. And you know, a lot of people, disabled people, just cast adrift during the pandemic. The support just wasn't there. And you know, when you're left in your own home isolated and the support taken from you, that just caused an you know, there wasn't the outcry to it that there should have been. And you know, the government will, you know, not enshrine the right to independent living into domestic law, and that is something we really do need to push for. And you know, what you're seeing, disabled people, Hammersmith and Fulham's the only local authority who doesn't charge for social care in London, but disabled people are paying, you know, £50 to £200 a week for, you know, their care support, and having to use personal independence payments to pay for that, and making stark choices. Am I able to eat? Am I able to pay for heat and everything? And during, you know, when you were shielding during the pandemic, that's an awful awful issue that, you know, we've been trying to highlight. So yeah, totally back what Ellen said and the way this government are going with social care. And it's got to be said that over 8 billion's been wiped off social care funding since the start of austerity in 2010. So, you know, and I actually met a carer actually in the week who told me that she's working 14-hour days, 6 days a week to support people in their own home. She looked absolutely exhausted, and she actually burst into tears in the place I saw her, and she said she doesn't know how much longer she's going to be able to continue to do that. And she hasn't had a Christmas off in 10 years. She's having to work all these hours over all these days, literally simply to make ends meet. And let's be clear on this point as well, that there are many care assistants out there, including within the NHS, who are having to apply for universal credit to meet the shortfall and everything like that, who are going to be hit by the £20 uplift going forwards. And that includes, you know, many care workers who are out in the community at the moment. So it's a travesty what's happening with social care, and the government are failing dismally to address it.
Well, thank you, Paula, for coming on. We'll see you next week as well. We're coming on next week. And thank you, Ellen. And I wanted to talk about the financial side of this, because this has got a lot of the headlines, more than as we talked about the disabled people who are not being mentioned at all. And to speak about that, we're lucky to have Professor Prem Sikka, who was a former advisor to John McDonnell. Are you there, Prem?
Yes, I'm here, Crispin. Good morning, everyone.
Good morning. Thank you for coming on. We've just heard about the situation for social care, not only for older people, but for disabled people as well. I mean, what is the government doing to address that shortage of funds and resources for people like Paula and Ellen and others who are supporting disabled people?
Well, actually, the government's not doing a lot. Let me just sort of remind everyone, we are all one accident or serious illness away from the need for social care. So, and social care is not just an issue about the elderly, as the government continues to promote. If you look at the actual expenditure, about half is on working age adults. And so the fundamental fault lines are that if anyone's suffering from cancer, they're entitled to unlimited care without any payment, which is quite right. But if anyone suffers from dementia, Parkinson's, motor neuron disease, and a variety of disabilities, then the care is means tested. That is wrong. We need universal free social care for everybody. What the government has done is now hiked up taxes for the poorest in the guise of national insurance contribution, 1.25 percentage points. And at the same time, there is no national insurance for the rich. For example, last year, £65 billion of capital gains were declared. There is no national insurance on capital gains, dividend, and other forms of unearned income at all. That is wrong. The government's also hit pensioners who might be trying to top up their meager state pension. Our state pension as a percentage of average earnings is around about 25%, and it is the lowest in the industrialized world. So the government's hit those as well. And none of these things were necessary. If we were simply to tax capital gains, which are the tax regime on that advantages about 263,000 people. If we tax capital gains as earned income, that would raise 19 billion or 17 billion pounds a year plus national insurance contribution thereon. If we taxed dividends in exactly the same way as earned income, that would raise another 5 billion. We at the moment, the government gives tax relief on pension contributions of about 40 billion pounds a year. And the vast majority of that goes to individuals who pay tax at the 45 and 40%, very little to the basic rate. There are 1.5 million people who take out pensions but get zero tax relief because their income is less than £12,500 a year. So if the government said, we will give everybody 20% support, regardless of what their income is, that would release another £10 billion. I could give you numerous other examples. So there is plenty of money available. The problem we have is an ideological one. The government does not want to fund the social care. And I at the last Monday's Parliamentary Labour Party meeting, I was there. I personally spoke up, and I have urged Keir Starmer to address this, and I will follow this up again on Monday. I want the Labour Party to offer us an integrated national health service and care system where everybody has free access to social care, because everybody sooner or later may need it.
Yeah, well, thank you for raising that. I didn't know that you'd spoken at the parliamentary meeting there. We've also got on the call Andrew Fisher. Are you there, Andrew?
Yeah, I'm here. Hi.
Can I just? I don't want to. I know, Prem, you did speak on this, as you just say, on Monday. But I just wanted to play this clip that people have been showing a lot of in the week.
When it comes to funding it, I wouldn't look to working people and have a tax hike on them.
I know what you're against.
I would say that those with the broadest shoulders
what does that
should
mean?
pay. Well, that means that those that earn their money or their income from things other than work should pay their fair share.
The wealth tax.
Well, there's a whole range of.
I've got some here that Rachel Reeves talked about in the comments yesterday.
People who earn their money from property, dividends, stocks, shares, capital gains tax, these should all be looked at as a broader fairer way of raising taxes.
So in principle, you would prefer a wealth tax of some sort?
I think we should look at all of these options, and we shouldn't say that the whole weight has to fall on working people, that the people who earn their living from a wage, why shouldn't those that get their money from other means, whether it's dividends, stocks, shares, property, pay their fair share? And the landlord example is a very important one. Why should a landlord not pay a penny, but the working tenant, because they're earning a wage?
You would prefer wealth
rent?
taxes than a raise of income tax?
I think we should look across the board at something that is fair, but at the moment...
You would prefer a wealth tax to raise an income tax?
I think we look at a broad range here, but the idea that we don't... The one thing that
Can you just answer that? Just, do you prefer, in principle, wealth taxes to income tax increases?
I think we need to look at a range of options.
You're not going to answer?
Well, we need to look at a range of options, but that includes the way people earn their money, whether it's from earned wages or whether it's from rent or stocks and dividends. And I think we should look at all that, because in the end it should be the principle that those with the broadest shoulders pay their fair share.
I'm trying to pin you down because I actually want you to say yes or no, I think we should look at a wealth tax. It doesn't commit you to the policy. It just says to me that that's your preferred option, and that's very clear, and it's very clear to the public.
Yes, all of those options are a wealth tax. I mean, you know, in the broadest sense of the world, and we should look at it.
Andrew, you were advising Jeremy Corbyn. Obviously, the media are quite difficult to work with sometimes, and they try and make you look like you're avoiding the issue. But do you think Keir Starmer could have been a bit clearer there?
Yeah, I think he could have been a bit clearer. I mean, I think the biggest problem with that clip is not the sort of principal argument he's sort of grasping around for, and getting some of the detail a bit muddled, and and kind of just looking a bit like I don't really know what I think about this. I think the problem is twofold. One is he says, look, we've got to look at different ways of funding it. What is the it he's talking about? Which goes back to the points that Ellen and Paula were raising before, and the principal argument that Prem laid out at the start is, what is it you want to get towards? And I don't think he knows that. Labour hasn't said what its model is, under this regime, and that in a sense is quite frustrating. It's interesting, you've got Andy Burnham, who came up with a model which wasn't perfect in 2009-10, towards a national care service, the document that was published in the sort of dying days of the Gordon Brown regime. That's sort of, that's not being discussed. The stuff that we were working towards, which was far from perfect as well, I'm first to admit, but was getting there, had stepping stones towards actually a fully funded, universal free national care service, was the end point, and how you got there in stages because of where care is at the moment was the debate about how far you could get towards that under, in one parliament and so on. I think we need to be more ambitious, to be honest, but there were internal issues with that as well. But, look, that's the principle. I think you need a kind of, here's the end point, here's the system we want. Then you talk about how you fund it. And there are lots of ways. I mean, I wouldn't rule out income, by the way. I mean, look, in the last manifesto, we said we put the 45% rate down to 80,000, which is the top 5% of earners, in fact, just under the top 5% of earners, and a 50% rate at 126, 123, something like that, sort of boundary where the weird personal allowance thing cuts in. I forget exactly where it is. It's around 125 grand, which is, again, the top sort of 2% of earners by that point. So again, there are lots of ways to fund this. Funding it isn't the problem. The problem is setting out an argument for why, and painting it. You talked about painting in primary colours. Actually, the point Prem just made is the key one. Why is it, if you have a heart attack, if you have cancer, if you have all kinds of, physical ailments, if you like, or kind of, physical conditions, you're treated for free on the NHS. But if you have dementia, if you've got all, motor neurone disease, if you've got various disabilities or immobility even, you're not, you have to pay. That is in principle wrong. And I think everybody in the country would win, you could win people over with that argument. It's very simple. And I think that's the argument we need to do. We need to build a kind of Beveridge style consensus, because I think a lot of the time at the moment, and you see it reflected through the journalists and the media talking about it, they don't understand social care. They might understand a bit of it, perhaps they've had to deal with an elderly relative going into a care home. But then even that's not all of it for older people. There's domiciliary care. There's adult social care for working age disabled people as well. There's, what we want in terms of independent living, and what would that look like within a national care and support service. all of this needs to be spelled out, and that argument, Bill, getting dug down in the weeds of the funding. Look, the funding should be as progressive as possible. We all agree with that. Redistributive taxation, tax wealth, but you've also got to tax high incomes. The reason you get these big accumulations of wealth is because people's incomes are so uneven. You know, in part, obviously, it's partly to do with inheritance and elsewhere as well. So Andy Burnham's argument for an estates levy of 10% on all estates, you know, you can argue the toss over that, or whether it's good, bad, indifferent, or perfect or not. But it's a start, and it's a bold kind of argument. And then he says, look, we've got to up general taxation to fund it. I don't believe in hypothecated taxes. I think the minute you start going down that route of this kind of narrow, this is what it's for, well, what if need increases? What if need decreases? Do you cut the tax? Do you raise it? It's a silly way of funding things. That's why we have general taxation in this country broadly. And so I do think we need to rebalance our taxation system for the reasons of fairness, not because of that. There are lots of options you could do, but the primary purpose that Labour needs to kind of get towards is building a kind of national support, a national consensus, a Beveridge style consensus that then Bevan implemented, you know, in the teeth of huge opposition still in the post-1945 government, for a national care and support service. And I think that is ultimately where Labour's got to get to. And it's as you saw from that clip, I don't think he knows what the it is he's funding, and I don't think he's got an answer on the funding either. So that's the problem. But the primary thing is the argument to win people over, to convince people to pay more tax, or that tax rises are needed even for other people. People want to know what it's going towards, what the vision is. And I think that vision is entirely winnable because it's moral and just so obvious.
I might bring Prem back in here. Prem, when you spoke of that PLP meeting, was that before that disastrous interview or after?
I think it was before. It was on Monday. That was before Johnson had actually announced. But I had actually written to Keir Starmer on 25th July and sent him a briefing paper, which I had prepared for a number of backbenchers in the Lords, where Peter Lilly had floated a bill about insurance-based approach to social care, which I detest. And I then decided that the Labour front bench ought to see it, because that document, I don't know if you've seen, some people may have seen it, it talks about fundamental fault lines and problems. Privatisation of social care has been a disaster. 26 corporations who are the leaders in providing residential care in care homes, they operate through a labyrinth of 2,500 companies, which gives them huge opportunity to shift profits and cut costs. That has been an absolute disaster. Private equity basically are skimming, profiteering from it. I draw attention that 24% of all the staff in private care homes are on 0-hour contracts. There's annual staff turnover of about 30%, vacancies around about 170,000 a year, which mean personalized private care is impossible, because you just don't really know who you're going to see the next time. So I outlined all these things in that paper, which I sent to Keir Starmer and also a number of other leading members of Shadow Cabinet, to say, look, here it is, something for you to think about. Now, whether they thought about it, I do not know, because I didn't really get any feedback.